Shall we begin?
Sure.
Okay. And you can hear me and see the screen well? Good. So we're here to talk about WPSI, the Women's Preventive Service Initiative. And I love how Sue phrased it, women's health more than an annual event. And honestly, counting on all of you here to be able to be a voice for WPSI is probably the most important outcome from this meeting. When we talk about women's health, we firmly believe that when we invest in the health of women, we are investing in the health of this and future generations. And that investment is critical.
So, and what we should have mentioned at the beginning also is Happy Women's Health Week. We purposefully planned this for this week because it's a time to reflect not only on our own health, but the health of women in our community, in our state, in our country globally. And that's really what we're trying to do. As you can see, we both have a passion for women's health, and that passion is really about making sure that women are as healthy as possible. So think about this. Imagine this woman, a 36-year-old woman, obese, she has diabetes, and she may see a variety of providers, an OBGYN for well woman, an internist for her diabetes. She may see a nurse practitioner, a family physician, and the care that she receives may be a little bit different depending on the lens that that provider is viewing her through. So for example, her internist may be thinking about her diabetes and not necessarily about preventive care. Or think about an 18-year-old woman who comes in. Generally we sort of think about just certain pockets of care for different age groups, when in reality, preventive services goes across the board. So the goal of the Women's Preventive Services Initiative is really to get all providers and all women on the same page in understanding what preventive services are recommended for each age group so that that care can be consistent and women can understand the care they deserve and how to access that care.
And that's probably the most important concept, because we're here to develop and update all the recommendations for preventive health care across a woman's lifespan. And what Sue has pointed out is the most important thing. We can, as an OBGYN, if I only do a pap smear and a breast exam and then say you're out the door, I missed the most important parts of that woman's health. And likewise, if I'm an internist and I forgot to ask what birth control you're on, and I just put a woman on a potential medication that could cause a birth defect, I've missed my best care for them.
So it's really important. And, we have a lot of information about taking care of ourselves. So why have a whole program dedicated to identifying recommendations around preventive care? Well, because that's really the foundation of what keeps us healthy. It allows us to screen for and manage chronic disease. We may have high blood pressure or hypertension or diabetes or lung problems. And if we aren't seeing a healthcare provider and getting those screenings, we may not know that until we're a lot sicker. Making sure our immunizations are up to date, detecting infectious diseases, sexually transmitted diseases, and so forth. Reproductive life planning so that women have opportunities to think about when they want to have children, if they want to have children, making sure that if they desire a pregnancy, that they are as healthy as possible going into that pregnancy and staying healthy between pregnancies as well. We hear a lot about lifestyle, optimizing our nutrition and our exercise. Well, sometimes it helps to have a little bit of support in understanding that and in understanding where our weight really falls and what the health risks might be. And certainly, we know that psychological and behavioral health issues oftentimes aren't talked about as much as our medical problems. So without having a preventive visit where you are actually screened and discuss symptoms of depression, symptoms of anxiety, and so forth, those conditions can also be missed. Okay.
So when we look at WPSI, what is it? Well, first and foremost, and for us, really, the key is that it's a federal grant. It's supported by the Health Resources and Services Administration in the U.S. Department of Health and Human Services, which is absolutely critical. It is a 5-year cooperative agreement between ACOG and HRSA and the Child Health Bureau. We received the grant in March 2016. It goes until February 2021. Of course, those of us on WPSI are hoping that the government sees the benefit, that we hear from our patients, hear from everybody, that there's a great value in it, and that the funding will continue, because we believe that this work is critical. And it's always like looking at two sides of a coin. First, we need to be able to develop the recommendations, update any recommendations that already exist, but then develop anything to provide guidance to clinicians and to patients alike about what should be their health care. But if we don't figure out a way to implement it, we failed. So we need to be able to disseminate all of this information very broadly. The recommendations need to be shared with providers and women alike. So in terms of that, you might say, well, why WPSI? As Sue already said, we've got all of these clinicians, and everybody has some kind of guidance that they provide. But there are gaps for the average risk woman. There are certainly gaps for women with multiple medical problems. Right now, we're talking about the average risk women, and we're addressing inconsistencies in guidelines. So for example, the family practice docs may have looked at a guidance one way, internal medicine another way, nurse practitioners and OBGYNs a different way. How do we take all of those discrepancies and come up with one set of agreements that we're going to abide by? That's the tricky part. Takes a lot of time, and we've worked on it. So guidelines themselves may be very complex. They might be unclear, difficult to implement, and clinicians alone might not be really sure how to do it or what to do. They don't necessarily follow what we would consider the best practice. Certainly there's patient confusion. I think we all saw that when some of the mammogram recommendations came out, and everybody across the United States was confused. Cervical cancer screening alone can be very confusing. You know, do I go in 1 year, 3 year, 5 years? So how to take this guidance and make it clear. And then clearly there are disparities in screening procedures that reflect both racial, ethnic minorities, literacy, the poor. So we're trying to come up with a handle on all of that, and then try and not duplicate great efforts that have already taken place. United States Preventive Services Task Force already does a lot of work. If they've got guidance, we just accept it. That's it. We're good there. If the CDC has guidance very clearly around vaccinations, we accept it. And then the American Academy of Pediatrics has had a very long standing program called Bright Futures. We accept that. So we're not trying to remove any well-established guidance. We're trying to add to it.
And here's the other piece of it that's really important, because healthcare is available. How does it get paid for? And as you may remember, when the Affordable Care Act was passed 10 years ago, there were preventive services provisions in that, and there were required preventive services that needed to be included in all credible health insurance plans. And those services are evidence-based items, services with an A and B rating in the U.S. Preventive Services Task Force recommendations. So again, those are some that we are not replacing. Immunizations recommended by the CDC's Committee on Immunization Practices are followed. And then that third element, the third and fourth elements are where WPSI falls. HRSA supported evidence-informed preventive care and screenings, comprehensive guidelines for infant, children, and adolescents, and then WPSI falls under that fourth, comprehensive guidelines for women. So once WPSI makes a recommendation and HRSA that's the Health Resources Services Administration, once they accept it, then that under the Affordable Care Act is available to women without cost sharing. So for example, when you go in for your well woman exam, 10 years ago, we were paying a copay. Within the last probably 5 to 8 years, we've not had to pay copays for our well woman exams. That's where that falls under.
Can I do that?
Mm-hmm.
Yeah. And then I'll let you discuss this political aspect too.
So, but here's a really important point. that doesn't apply to everyone because there are exceptions. So what I just described in terms of the preventive services that are to be included without cost sharing for women, most private insurance plans, both large and small group plans, as well as individual plans, including those under the Affordable Care Act's marketplace, must cover the preventive services, the following preventive services without charging a copayment or coinsurance. So, and those are all of the recommendations that I talked about on the previous slide, but there are some exceptions. This also applies to the Affordable Care Act's Medicaid expansion program. So states that are Medicaid expansion states, those states that have made Medicaid available across the board, do abide by preventive services, by the preventive services guidelines. So the services that we're going to be talking about are available to women in those states. However, in non-Medicaid expansion states, that is not the case. Missouri is a non-Medicaid expansion state. So in non-Medicaid expansion states, for people who qualify for Medicaid through other pathways, so for instance, pregnant women, women who meet the financial threshold and have children on Medicaid, blind, disabled, and so forth. The states may choose to, but they aren't required to cover this list of preventive services. So there's a bit of an inequity there in terms of who actually has access to this. And likewise, Medicare will cover the full cost of an annual wellness visit, but only the preventive services that are rated A or B by the U.S. Preventive Services Task Force. So the WPSI recommendations, and the other recommendations that we talked about are not necessarily included in Medicare plans.
Great discussion for that, great description. I think it's one of the hardest, for us, it's one of the hardest parts of WPSI and the Affordable Care Act. When I became president in 2013, my presidential address said, "This is the year of the woman," because for the first time in the history of America, preconception health care was covered, prenatal care was covered, depression screening, cervical cancer screening. So it is an incredible opportunity to see all of the things that we believe are important for preventive health care to be covered in these health plans. WPSI has an organizational structure that really has worked for us these past almost 5 years. We've got the ACOG, the OBGYNs, the College of Physicians, the internists, our family physicians, our nurse practitioners in women's health, and then we've got members of the National Academy of Science, and they've really been helpful because they bring the perspective of the National Academy of Science. And then the Pacific Northwest Evidence-Based Practice Center. Sue will go into that a little bit later, but they firmly keep our toes in the research and in the evidence, which is critical if you're going to make these kind of decisions. And then, as I said, we've got, it's important for us to come up with the guidance. So we've got a multidisciplinary steering committee that chooses topics. And then we've got a dissemination and implementation steering committee that makes sure that we can pull all this off.
And just a little bit about the methodology. The reason that the Evidence-Based Practice Center is so important is because they do the research. They are the ones who, if we come up with a topic, say screening for anxiety, they will delve into the literature to see, does it make a difference if we screen for anxiety? Have there been studies done? Where are the gaps and so forth? So we really look at, they help us look at the best available research and recognize really important research gaps, because we are really learning that we don't have a lot of research on how these preventive services play out in terms of racial and ethnic minority women. Not only in terms of, are they the best screening tools for that population, but also are there access issues, and looking at underserved populations as well. Once we look at the research, if there are gaps or research is lacking, we look to clinical experience and consensus from the group, and there are about 21 different flavors of healthcare professionals that sit on that multidisciplinary steering committee. as well as subject matter experts, depending on what we're discussing. Um, the Evidence-Based Practice Center oversees the strategies, the study selection, and so forth. And then once their work is done, they summarize all of that and present it to that 21-member multidisciplinary steering committee to come to consensus around the recommendations. And that takes a lot of work. This whole process takes anywhere from 6 months to a year to get from idea through the research to the recommendation that is published. Once we have that recommendation come out of the multidisciplinary steering committee, it actually goes to you. The recommendations are subject to external review. They are placed on the WPSI website. We put a call out for comments. How feasible is this? Does this really matter? Does it make a difference? And so now that you know about it, we would hope that you would be watching our website and chiming in on that as well. One of the things that I think is really important about our process is that we really minimize the impact of individual bias and conflict of interest. We have a very strict conflict of interest policy because we are issuing national recommendations that are going to affect women's lives. So anyone who has contracts with anything that could be perceived a conflict of interest, for example, pharmaceutical companies, medical device companies, and so forth, are excluded from the panels for that reason, so that we can look at the best evidence and make the best recommendations without perceived or real conflict of interest.
And we keep all of that information available on the website if anybody has questions about it. So it's really been helpful. I get to show you the picture of our Well Woman chart. And then we're going to go through it. So we'll go through it next. But the Well Women chart is on our website. You can download it. We've made it available for clinicians in their offices. But it's a great reference. The reason I like it on the website is as we make changes every year or after a decision, we can quickly put that into the chart. It's divided into 5 different areas. The 5 areas represent general health, vaccinations, prenatal care, infectious diseases, and postpartum care. So we've got five basic areas. Most important really are the general health and the infectious diseases and cancer screening. Sue, did you want to cover this?
Sure. And basically the beauty of the Well Woman chart, and again, Darcy has links, and I think one of the other slides has the website on it as well. It's really a comprehensive tool, and it takes all of those, we've been talking about all of these different committees that most people have never heard of. We've got WPSI, the U.S. Preventive Services Task Force, Bright Futures, the immunization people. When we go in for our well care, we probably aren't thinking about that. We just assume that the healthcare provider knows that. Well, our Well Woman chart puts that in one easy place. So it takes all of those recommendations, they're in one place, and they are age stratified. So if you are a 40-year-old woman going in for care, your provider and you can look at, these are the things that are supposed to be happening for my preventive visit versus a 64-year-old or an 18-year-old. And it really takes into consideration some of the things that we look at are the clinical practice considerations. What kind of risk assessments are we doing? Are the risk assessments valid? Have they been validated? And the age and the frequency of when to deliver the services, all of that is in clinical summary table. So, if you wanted more information, you could get as much information as you want.
We'll flip through a couple of these pages just for you to see. So here's how the chart itself is organized. And we're going to highlight just one part, aspirin to prevent cardiovascular disease. But as you can see under general health, it's everything from alcohol screening and counseling down to urinary incontinence screening. And then we make recommendations across the age span for who should be receiving screening at what time. And the next page then, Sue, I'll leave that for you.
Okay. And if
you want me to do this one? Yeah, I'll carry through. So for example, we chose low dose aspirin screening to prevent cardiovascular disease and colorectal cancer. So we've got, see if I can go back. So quickly look across, and the screening starts at age 50 to 59. And then in this section of the text, we explain why. So low dose aspirin is effective for those who have a 10% or greater 10-year risk of cardiovascular disease. So there's a little tool that you can click on and see what your risk is. If your risk calculates out high, then we'd recommend aspirin screening. That's a tool that your doctor often will have embedded into their medical record. For my patients, when I would see them, the medical record alone would take in their age, their cholesterol, their family risk factors, and I'd push a button and the calculation would be there for me. So we've got that. And so we go over the clinical practice, the risk assessment, and then give everybody the references that they might need. So it makes it very, very helpful for our patients, or the table, which is really easy to follow.
And, you know, one of the other things I'd point out on that slide, the URL that's there, that will take you directly to the WPSI website, and you can download the Well Woman chart. And I find that really helpful. I also have like 100 of them in my office, so if I ever get to see anybody in person, you can have your very own laminated copy. But, you know, I found it really helpful. I mean, when I go for my healthcare visits, I have gifted the charts to my personal healthcare providers, my OBGYN, as well as my internist, because I think it's important that they know that for all of their patients. And sometimes the word doesn't get out, so we all do our part. So you can go on there, and there's an interactive chart where you can look at, you might be interested in, for example, screenings around heart disease or whatever. You might be able to look at that, or you can just download a PDF of the chart. Okay, we can go to the next.
Yeah.
And then there are some specific patient-facing documents that might be helpful. There is a patient resources webpage that you can find helpful information. There is now a telehealth information page that is really targeting more providers, but I do think it gives some information that are helpful, that's helpful to women, because some of our Well Woman exams, you know, obviously you've got to go in for your pap smear and you know, your mammogram and so forth. But with COVID, it's difficult to do that sometimes. And if there isn't a medical emergent issue, sometimes women are delaying. And yet those preventive care touch points are really good, because screenings, a lot of the screenings for mental health, screenings for intimate partner violence, screenings for, you know, discussing obesity, those kinds of things are really helpful touch points. And during this time, it's kind of good to have a touch point with your provider, and those can all be done via telehealth. So there's some information there, and this great trifold that talks about women's preventive services and kind of what's available, as well as the Care Women Deserve website that details some of the specific preventive services that women are interested in and what that means in terms of the no cost sharing parameters. So again, Darcy is going to be sending you a one-pager with all of these links.
Great. Implementation. As we've said a couple times, we can come up with all the recommendations that we want, but if we don't figure out a strategy to help you know that these are out there, or help your healthcare providers know it's out there, we failed in our mission. And so we've got a good look at implementation. We call it the DISC, the Dissemination and Implementation Steering Committee. And again, it's made up of OBGYNs, family physicians, internists, our nurse practitioners for women's health. Consumer organizations bring a great deal of information to this and give us the perspective. What's it going to take to get the information? What do people look for? What are the bloggers saying? What are, you know, the different advocates saying? We actually have implementation scientists, because they know how we can be most effective. And then we certainly are partnering with both federal, state, and local agencies. Anybody who's got insight into business groups and the business group on health, or insurance companies, how do we get the word out there? We want them to participate in the work that we're doing. But the steering committee itself is made up of these groups.
You know, and the DISC and the implementation piece is really so important, because we want to make sure that there is consistent, coordinated, and focused messaging out there. Again, getting everybody on the same page so women know what to expect from their healthcare when they go in for preventive care, and that all of our providers are on the same wavelength around this. It's important to collaborate and coordinate collaborative efforts. You know, women's health is a team sport, and women access care from a variety of different providers And so we want to make sure that those efforts are collaborative and that everybody has the same information. Importantly, providing the information helps to empower women to access the care they deserve. And community involvement is really important. You know, on the last slide, when Jean talked about having federal, state, and local input at our table, that goes both ways. I think everybody who's involved with WPSI takes this out with them. So for example, since we're sitting in Missouri, I can tell you I am vice chair of Missouri's Women's Health Council under our Department of Health. So they have heard this and they have been gifted with their very own charts. I've had meetings with the St. Louis Board of Health around WPSI and the importance of incorporating women's wellness is in everything that we do. You know, have spoken with consumer groups in St. Louis, in the St. Louis area, and actually statewide around this, and other states, even where I don't live, because it's so important to have that community involvement, because we're all ambassadors around this. We want to make sure that we also align these recommendations with national quality metrics, because that is really what drives healthcare to be better. We want to make sure that women are accessing these services and that they're actually making a difference. Also, preventive care is actually way less expensive than care for an illness. So by actually, and so it was really actually a really smart thing to do by encouraging people to access preventive services without cost sharing, because we know that even sometimes $10 is a detriment for people accessing care. So if we can get people to access preventive care earlier and regularly, we have the opportunity to really tee women up to be healthy throughout their lifespan, which also helps to maybe delay the onset of chronic disease or help them to cope with whatever chronic disease or other illnesses that they may be faced with. We are looking at pilot projects to demonstrate exactly what I just said, and we look to the DISC to help us become innovative and creative in trying a whole bunch of different strategies so that we can really facilitate the access to care.
And I've just decided that I'm going to add one extra line to this, and that would be cloning Sue Kendick, because if you do all that from Missouri, we need you in every state.
We'll do a training program.
So we mentioned the Care Women Deserve project, and this is really just a coalition or alliance of organizations that are dedicated to educating people about women's preventive health services. So their Twitter sites, a number of different links, and Sue, I'll just go through the next one that shows the $0 prevention there. But what we did was create a number of different easy blogs, tweets, anything that can get this out to let people know that it's out there. So in our social media realm, how do we get some of this information available? I'll let you cover the get involved.
Sure. So, you know, I want to point out that in the last slide, you know, there are things in there about preventive services that sometimes we don't even think about as preventive services, like breastfeeding supplies. And yet, you know, we know that breastfeeding is good for the health of both the mother and the baby. So again, investing in women's health and preventive services really does make a difference in women's lives and for future generations. So, you know, by listening to this, we get to deputize you as ambassadors for WPSI, because we want everybody to be involved in this. I would invite you to download those recommendations, the Well Woman chart. Make sure that your family members, your friends, your providers know that this exists. If you are interested in the additional resources, download those and have those available. Importantly, provide feedback on our website. If there is a preventive service that you think we need to consider, I think that's really important, and participate in the public comment opportunities. Just to give you an example, our most recent recommendation that was approved by HRSA is screening for anxiety. And while we were debating that, I was at a baby shower for my daughter, and three of her friends kind of talked to me for a really long time about they don't understand why people don't talk to them about anxiety. And they talked about anxiety in their lives and how important that was, and they didn't know how to approach their healthcare provider. And so I was really proud of us when we shepherded that anxiety recommendation through, because it's something that's meaningful that sometimes people have a hard time bringing up. So participate in those public comment opportunities, both to tell us what you think about the recommendation. Does a recommendation around, for instance, obesity make sense? What does that look like? And what are the things that are important to women that maybe there are gaps in the topics that are being discussed? And join our listserv. Jean?
Thank you. We've got some links here to WPSI. Our program directors are fabulous. You can contact them. Going on the website is probably the best. Becoming a member of the listserv so they can push out information when it comes. And then please making your suggestions and your ideas be known. We do want to hear from everybody. You can say, I think we should be screening for something. We will then look at the evidence behind it. We think there are things that we should screen for, but then trying to find evidence that supports it is actually can be pretty hard to come by. So this has truly been a team effort to get where we are. And like I said, we're hoping for another 5 to 10 years of funding to keep this work going, because when we invest in the health of women, we're investing in all of our futures. Thank you so very much.